Hi, welcome to Case of the Day, and we've managed to get to the ninth week. Um, I'm as surprised as anybody that I've been able to do this. Anyway, 33rd case diagnosing a paravalvular leak. So this scan was done on Saturday, and then I saw this in the morning. 17-year-old boy, surgical aortic valve replacement 2 months ago for bicuspid aortic valve and severe aortic stenosis. And the echo was suggestive of a paravalvular leak with a regurgitation. And apparently the valve was rocking on the echo, but there was still some doubt, and so the surgeon sent the patient for a CT angio. So this has to be an ECG gated scan. You have to find the ideal phase with the least artifacts, which would be something like this. And then you have to orient the entire study in the LVOT plane. So if you're doing MR, you know that there is a standard LVOT plane, and then you would use the transaxials to look at things. So that's how you do it. That's the LVOT and two planes perpendicular to each other, and that's the transaxial. Now, when I was looking at the LVOT and scrolling through that, here is contrast outside the valve, and that's the first sign that tells us that there is a likely leak. But what we need to then do is confirm that the contrast goes from one lumen to another. So here you can see it tracks from the left coronary sinus. You can see this contrast here, and then it goes into the lumen just subjacent to the valve. And again, just like here where this artifact is obscuring the entry of the contrast leak into the infravalvular lumen, the same thing is kind of happening here. But if you look at the parasagittal, which is just perpendicular to this area of leak in the LVOT plane, you can clearly see the communication. It's tortuous, and you might need a curved MPR to look at this, but this is good enough where you can make out that there is a contrast going from one lumen to another. Plus, you have the echo. So you're looking at two modalities that reaffirm the fact that there is a paravalvular leak. There was this paper from, and it's a lovely paper from All India Institute that got published in Radiology Cardiothoracic that has a lot of stuff about this, and then it references a bunch of papers from 2014 and 2015 that first talked about this. And Prabhakar Rajaya's article here also has some stuff on paravalvular leaks, etc. But fundamentally, to diagnose a paravalvular leak, if it's the mitral valve, then the planes are different, but whatever it is, you need to be R phase. So if it's the aortic valve, then you need the LVOT view here. You have to look for contrast outside, and then you have to confirm that there is contiguity between the two lumina, which is done on these transaxial images and then reconfirmed here. So this is an image which is perpendicular to this in a parasagittal LVOT view, and so that tells us that we have a paravalvular leak. So this is just a technical thing about how to diagnose one, as and when and if and when you get a case and you're reading cardiac CTs, etc. That's my WhatsApp channel, and thank you so much for viewing this. Take care.